Doing really great, aren't we? Yeah,
We're doing great, sir. It's a great team to be part of.
yeah, no, it's amazing. Under my executive order to lower prescription drug prices, which I think is the single biggest thing we've ever done that nobody writes about because you're fake news. I've made unprecedented deals along with Bobby and Oz and all of the people that work on it. A lot of people that you wouldn't even think work on it, but they do, to slash drug prices by 200%, 300%, 400%, 500%, 600%, 700%, 800%. Nobody's ever heard of it before because I instituted favored nations, and no nation agreed to do it. And then I said to the nations, if you're not going to do it, I'm going to charge you 100% tariff, which is more money than we're talking about. And they said, sir, we'd love to do it. Please, we would be honored to do it. And they agreed that they would go along with the whole thing. Nobody thought you could do it because they felt, number one, you couldn't get the drug companies to do it. So we're paying, as an example, for the, let's call it the fat drug, F-A-T, for fat people. Anybody use it at the table? Don't ask. But the fat drug was $135. Think of that. For certain people, $1,300 for certain countries, $1,300 in New York. So in New York it was $1,300, and in London it was $135. And a friend of mine called me, he said, what is this? Why is it? He got used to paying $1,300. Well, now what we have it down to is, Bobby, what's the number? Like 150 or something? We have it down to a low number, don't we?
Yeah, it's around 100, 125, 150.
Yeah, think of that. So we got it down from $1,300 to $125 to $140, depending on various countries. In other words, we're paying the lowest price, tied for the lowest price in the world. It's, people said you could never do that because you couldn't get the countries to agree to it. I did. Every country agreed to it because I said, if you're not going to agree to it, that's okay, I'm going to charge you tariffs. And as soon as I said that, they said, we agree. And then we had to be a little tough with the drug companies, but they came along. The bigger problem was the countries. The countries just wouldn't go along with it, but they did, every country. So we have reduced drug prices by 500, 600, 700, 800, 900%, depending on the drug, depending on the company, depending on all of the different factors involved. Nobody's ever even thought of drug reductions like that, price reductions. And I told you the story that in my first term I was so proud of myself because I reduced drugs. It was the first time in 28 years that drug prices were reduced. It was 1/4%, 1/4%. And I was so proud of myself. I said, it's the first time in 28 years that drug prices went down over the course of a year, over the course of a presidency. 1 year. 1/4%. I had a news conference. I was so proud. Now I got them down, not 1/4%. I got them down 400, 500, 600% and more. And the fake news won't write about it. And it's going to have a huge impact on healthcare because a big part of it's buying drugs, buying prescription drugs. It's going to have a huge positive impact because Obamacare is a disaster. I said it years ago, and I say it now, and the money should be paid, taken away from the insurance company. Obamacare was made to make the insurance companies rich. Their stocks have gone up 1,000% in a short period of time because the money goes to the insurance company. I want the money to go to the people. Let all the money go to the people, and let the people go out and buy their own health care. And I see on television, people are advertising now, we will help you buy health care. We will go out and help you buy. That's becoming like an industry because of what I said. So something's going to happen. It's probably not going to be easy because the Democrats, frankly, they don't want to make a good deal for the people. They just want to make a bad deal for the country. They want to make a bad deal for the Republican Party. But the Republican Party is united, and I will say that what I would like to do is the money doesn't go, trillions of dollars get paid to drug companies. And you still have lousy health care. Obamacare is horrible health care. We want it to go to the people, and then let the people go out and buy their own health care, and they'll do great. They'll do great. So we're negotiating that now with the Democrats. Well, congressional Democrats